Hello and welcome to the Power Tools webinar series. I am Kinkini Banerjee, the Coalition Relations Director at USBC, and I'm so glad to have you join us for this special session. The Power Tools series is organized as part of USBC's training, technical assistance, and capacity building support for our network of nonprofit organizations, as well as coalitions of all sizes, and any stakeholder who is working in the birth and breastfeeding field and wanting to improve the landscape of breastfeeding support. We hope that these sessions bring you ideas and inspiration to all of us to collaborate and co-design more impactful policies, programs, practices, and strategies. Webinar announcements are sent through the USBC's coalition announcement list. And to streamline access, once you are registered for this, for any session, you're automatically registered for the entire series. So we post the session details 1 to 2 weeks before a webinar. You get reminders as well on your email. And then this is our public page where you can go and look at what the topic is about and also look at our archives. So the webinar page is www.usbreastfeeding.org/power-tools. And like I said, we know that folks cannot attend every session live. So all of these sessions are recorded, so you will be able to see them and watch them at your convenience. Your email should have the link to the webinar, but if not, you can also go to the page. We also often add other resource materials along with the slides. So for slides and other resources on this session, you can go to, again, the Power Tools page on our webinar and on our web page. And I can, here's how you do it. You can go to www.usbreastfeeding.org to our homepage if you don't have the direct link, and you've deleted your email, which has the direct link, and then look across the tabs and you'll see the one for webinars. Click on the webinars tab and you'll see all the four webinar series that USBC hosts. Click on the Power Tool webinar series and it'll open up. So for today's webinars, you'll find the slides, a PDF of the slides, as well as a couple of other handouts. Because we have a large number of attendees, attendees are in listen-only mode, but we do want to have this as interactive as possible. So please submit your questions at any time during the webinar, and you can type them in your question box on the webinar control panel. And you should, if you don't see your control panel, it might be minimized. So look at that little orange tab with the white arrow. If you click on it, your control panel will pop back out. If you look at the section, you'll see one section called audio, and then immediately under it, another blue tab called questions. If you click on the questions tab, a text box will open up for you. So again, please be sure to send comments and questions as they come up for you during the presentation. During this session, if you have tech-related issues, audio problems, you can either put them in the chat box for us, the questions box, or email coalitions@usbreastfeeding.org, and our staff should be able to help you. And that brings me to today's topic, the World Breastfeeding Trends Initiative and the US results. The World Breastfeeding Trends Initiatives, or WBTI as it's referred to, is a unique tool, and it tracks 10 indicators on key breastfeeding policies and programs and 5 indicators related to infant feeding practices. And this tool helps countries assess and report gaps. It also is a really great way to launch a call to action for governments to address and bridge the gaps that are there in breastfeeding support, in the landscape of breastfeeding support. So during today's session, we'll hear how the United States scores on the World Breastfeeding Trends Initiative, and see how we do in supporting, protecting, and promoting breastfeeding. We'll also learn both national and state data and explore how USBC member organizations, coalitions, task force, work groups, and other stakeholders can use the WBTI data to identify areas of focus and strategic goals. So this really is a very core component of our power tools. Have this in your toolbox for your long-term, mid-term, as well as short-term strategies. And I am so honored to present today's speaker. The USBC is honored to have Dr. Karen Cardwell, a nationally and internationally renowned speaker, researcher, and educator. Dr. Cardwell is the executive director and lead faculty of the Children's Healthy Project's Center for Breastfeeding, and convened the Baby Friendly USA, which is the organization, as you know, which implements the UNICEF Baby Friendly Hospital Initiative in our country. Dr. Cardwell counsels breastfeeding mothers at the Center for Breastfeeding, which is a community-based lactation clinic on Cape Cod in Massachusetts. She's a delegate to the U.S. Breastfeeding Committee, of course, and she's been a member of the. She's been a faculty at universities, at the Union Institute and universities, both their undergraduate and graduate programs. She's been the visiting professor and chair of the health communications at Emerson College, which is part of the Tufts University. We know her as the author of numerous books and articles, including the Pocket Guide for Lactation Management, Breastfeeding A to Z, and so many more. She's has led delegations focused on breastfeeding and human lactation across to many other countries, including China, Sweden, Russia, Romania, Cuba, Egypt. Dr. Cardwell was awarded the IBCLC designation in 1985 for significant contributions to the field. She's one of the key leaders recognized for her role in the formation of USBC, in understanding the need for the multi-sectoral organization. At the 6th National Breastfeeding Coalition's Conference in 2016, Karen Cardwell was celebrated as a recipient of the USBC Legacy Award for her immense impact in the breastfeeding field. And like her organization, the Healthy Children's Projects, Karen's legacy and mission is one that holds space and creates opportunities for others to succeed. Her vision of the idea that babies have a right to good health right from the beginning of their lives inspires so many in the field, as she's both a role model and a mentor to so many of us. So with that, I'm going to turn it over to Karen.
Well, thank you for such a lovely introduction. I have to thank you so much for inviting me and for this opportunity to talk about the World Breastfeeding Trends Initiative and how we are progressing in the United States. The World Breastfeeding Trends Initiative was the brainchild of the BPNI, which is a very, very formidable advocacy group in India, and the IBFAN group of Asia. And together they came up with the idea of the WBTI. The idea of the World Breastfeeding Trends Initiative is that every country that embarks on it should do it exactly the same way. And that means going through rounds of editing, beginning with the work done by the expert panel, and then the circulation of the draft. And the draft that I'm going to talk about today was circulated 3 years ago to the entire membership of the U.S. Breastfeeding Committee and the attendees of the National Breastfeeding Coalition's Conference, which had over 300 delegates, many of whom provided interesting, reflective comments and resources for consideration. And then the comments were collected and the draft was edited accordingly. our wonderful editor, Holly Hansen, collated the 300 people's comments, which was really an amazing job, and I have to laud her for that. And then the report gets sent to IBFAN Asia, and they check every single resource that we send them, because all of the resources have to be available online. And then the report was presented at the Second World Breastfeeding Conference in South Africa in December 2016. Now, the wonderful thing about the WBTI process, and there are more than 100 countries now that are involved, is that it's not just making a report, it's that they post the report on their fabulously interactive website. And you are really able to go in there and look at countries, compare countries in regions, and the website will make charts and graphs and all kinds of helpful tools for you to compare and contrast different countries and how they're doing. So currently, the panel has met again in the past couple of months to reevaluate our standing, because the rule is that you must repeat the assessment every 3 years. And this newest draft will be distributed at the conference in June and at the USBC meeting in June, again for a review by participants and for comments, corrections, etc. We expect this 2019 report to be submitted by the end of the summer, which will meet the 3-year deadline mandated by the IBFAN group. So how does this get started? You know, why is there the idea of the WBTI? Well, it is an innovative initiative that was based on the Global Strategy for Infant and Young Child Feeding. And although the Strategy for Infant and Young Child Feeding was launched in the beginning of the year 2000, I just read it recently again, and it's just as good now as it was almost 20 years ago when it was published. WHO and UNICEF have been working to sort of take down the silo effect of many of the initiatives, and this global strategy was one of the first attempts at taking down the silos between many of their initiatives, such as baby friendly and other initiatives that had to do with reproduction and nutrition. The problem with the global strategy was that there was no way to measure how well countries were doing. And so the IBFAN group and the advocacy group in India decided to come up with this tool in order to measure how countries were doing. So the tool is based on 2 global initiatives. The first one was the GLOPAR initiative that the World Alliance of Breastfeeding Advocacy launched in combination with the Infant and Young Child Feeding tool, a tool for assessing national practices, policies, and programs. So the WBTI was designed to assist countries in assessing the strengths and weaknesses of their policies and programs with the goal of promoting, protecting, and supporting optimal infant and young child feeding practices. And as Kinkini says, there are 15 indicators divided into 2 parts, and each indicator has a specific significance. Right. So the 2 groups are the first 10 questions deal with the policies and programs, and the second 5 questions deal with infant feeding practices. And I'm going to go through each one and talk about each one individually. So indicator number 1 asks questions about national policy, program, and coordination. The key question here is asking, is there a national infant and young child feeding/breastfeeding policy that protects, promotes, and supports optimal infant and young child feeding? And is the policy supported by a government program? Is there a mechanism to coordinate the National Infant and Young Child Feeding Committee and a coordinator for that committee? Well, the first question here is, do we have a child feeding, breastfeeding policy that has been officially adopted and approved by the government? And the answer is no, we do not. And then, of course, the next question, which asks, does the policy recommend exclusive breastfeeding for the first 6 months and then complementary feeding to be started after 6 months and continued breastfeeding up to 2 years and beyond? Well, of course not, because we don't have a policy. And then the third question, is there a national plan of action developed based on the policy? And is the policy adequately funded? Number 4, no. So we scored nothing on those first 4 questions. Fortunately, we have the USBC, because here we get a point for the National Breastfeeding Committee. And we score all of the rest of the points here because the U.S. Breastfeeding Committee meets, monitors, and reviews breastfeeding and infant and young child feeding on a regular basis. It links effectively with all other sectors like health, nutrition, information, etc. And the Breastfeeding Committee is headed by a coordinator with clear terms of reference, regularly communicating national policy to regional, district, and community levels. And it's too bad there aren't extra stars or extra points to give here, because the Rhonda Sauter, I remember when she came to visit the U.S. Breastfeeding Committee, was so impressed and said that it really outshines every national committee in the world. But unfortunately, we only get 4 points for that. So how do we score taking a look at the rest of the world in terms of indicator number 1? Well, you can see from this slide that there are a lot of green countries at the top, followed by the blue countries, which are next, followed the yellow countries, followed by the red countries. Where is the United States? We are right at the bottom of the yellow countries, as you can see. And in the map, you can also see that we're yellow. I want you to notice that there are several red countries in the world who score significant below us on this. Indicator number 2 asks the question, what percentage of hospitals and maternity facilities that provide maternity services have designated friendly based on the global or national criteria? And then what is the quality of the Baby Friendly Hospital Initiative program implementation? And you can see here that looking at the percentage of babies born at baby-friendly hospitals, and when this was scored, we scored 1. You should know in the newest scoring, we have moved up to get an additional point on this, we think. We'll have to see what you all say when you evaluate the work of the expert panel, but we think that we will now deserve 2 points for this. But the questions go on to ask, does the BFHI program rely on training of health workers, at least 20 hours of training? And yes, they do. There's a standard model in place, yes. Is there an assessment system that includes interviews of healthcare personnel? Yes, the baby-friendly assessors go to hospitals and they interview the healthcare personnel as well as mothers, which is the next question. And is there a reassessment system? Yes, there is. And is there a time-bound program to increase the number of BFHI institutions in the country? And you can see that we got a half a point here because the number of baby-friendly hospitals is included in the goals for the nation and in the Healthy People goals. If the BFHI is not included in the Healthy People Goals, we'll have to reconsider whether or not we have a time-bound program designed to increase the number of BFHI institutions in the country. HIV in the United States is not integrated into the baby-friendly program, and the national criteria are not fully implemented in the baby-friendly program. And that has to do with the percentage of exclusively breastfed babies at the time of the assessment. And up to this point, we have not included that as a requirement for hospital assessment. So how are we in comparison to the world? I want you to notice how many fewer green countries there are at the top here. The United States scores right in the middle of the yellows. And as with the U.S. Breastfeeding Committee, our baby-friendly work really puts us in good stead in comparison to other countries. Indicator number 3 is the implementation of the International Code of Marketing of Breast Milk Substitutes. The key question here is the code and subsequent resolutions in effect and implemented? And have we any new action to give effect to the provisions of the code? And the scoring here is the best approaches being considered. And once again, we have the U.S. Breastfeeding Committee to thank for this 0.5 that we received here, because it's really USBC that is thinking about which approach, and the USBC virtually from the beginning has had a committee thinking about how to move the code forward. And we know that the Surgeon General's report in the 1980s and subsequent Surgeon General's reports have call to actions, blueprints, et cetera, have all called for consideration of the code, although we have not moved forward in any kind of a policy way. So we have scored on this, the 0.5 that comes from the USBC. And where are we in the world? Well, you can imagine where we are, right there at the bottom. Put my glasses on to see who's below us. We are at the same level as Sierra Leone. And you can see the top countries here are Zimbabwe, Malawi, Ghana, the Dominican Republic, Afghanistan, India, and Gambia have all scored in the green for the implementation of the code. Indicator number 4 is about maternity protection. And this indicator asks the question, is there legislation or other measures, policies, regulations, practices that meet or go beyond the ILO standards for protecting and supporting breastfeeding for mothers, including those working mothers in the informal sector? And as you can see, looking at the guidelines here and the lack of check marks, that women are not covered in our national legislation and allowed maternity leave. Women are not covered by the national legislation, because we have none, that are allowed one breastfeeding break or reduction of work hours daily. So the question that comes up here is we get at least a half a point here for unpaid break. The problem is that it says women, which would mean all women, and under the legislation that we have under the Affordable Care Act, it's only women who are hourly workers. It does not apply to all workers. 4.3 asks whether private sector employees are legislated to get at least 14 weeks of paid maternity leave or paid nursing breaks many employers in the United States do give paid maternity leave, but it's not by legislation. 4.4 is questioning whether or not there is a provision in national legislation that provides for worksite accommodation for breastfeeding or childcare in workplaces in the formal sector. And there are many, especially large countries that have large organizations that provide for worksite accommodation, but once again, they are only for hourly workers. And creche, which is B here, creche is on-site daycare for small children. And again, we do not have national legislation that that encourages organizations to have creche set up at their work site. 4.5 asks about women in informal or unorganized or agricultural sectors. And again, are they accorded some protective measures? Are they accorded the same protection as women working in other sectors? And the answer is no. We do well with 4.6, and this is a trend throughout the WBTI. We do well about informing people. And so here we can see, do we inform workers about maternity protection laws, regulations? Yes, we do. And is there a system for monitoring? Yes, the Department of Labor has a system for monitoring and a way for workers to complain if their entitlements are not provided. The next questions are about paternity leave. And 4.8, paternity leave is granted in some places in the private sector for at least 3 days, but there's no legislation supporting that. And 4.9 is there's legislation providing health protection for pregnant and breastfeeding workers, absolutely about hazardous conditions. Thanks to OSHA, we have some really very, very nice protection here. And 4.10 is about prohibiting employment discrimination and assuring job protection for women workers. And you can see here, we did not score in 2016 on this, but we believe that you will agree with the expert panel that we now can get 1 point for that because of the lawsuit that finally concluded that breastfeeding was included in maternity protection law. So where are we in the world in terms of maternity protection? Yeah, what are we? I think we're 5th from the bottom here. We are above Swaziland, Palau, Nepal, and Fiji in terms of maternity protection. And one thing I want you to notice is that there are no green countries on this list. And you can see that on the map as well. There are no green countries that provide the maternity protection that was asked for in the global strategy for feeding. Indicator number 5 is looking at nutrition and health care systems and what they do in support of breastfeeding and infant and young child feeding. So the question here is, do care providers in these systems undergo schools and do their pre-education curriculum support optimal infant and young child feeding? Do these services support mother and breastfeeding-friendly birth practices? Do the policies of healthcare services support mothers and children, whether health workers' responsibilities to the code are in place? So you can see here that word inadequate on these questions and adequate on one. So let's take a look at them. About a review of health providers. Our infant and feeding plans adequate. Many schools today have programs that's in in the health provider curriculum. However, they are not as they should be, and that's reflected in many research studies asking dietitians, nurses, physicians whether or not they felt that their training was adequate in their job.
Karen, this is Kinkini. Sorry to interrupt. Your audio is sounding a little off once in a way, so maybe it's a mic thing. If you can be just a little closer to the mic. Thanks.
Okay, thanks. How's that?
Much better. Thank you.
Okay, thanks. And then the next question, 5.2, is asking the question about the standards and guidelines for mother-friendly childbirth procedures and support. And the mother-friendly childbirth procedures were not included in our baby-friendly hospital initiative in the United States, although there have been attempts at developing mother-friendly childbirth procedures and support. It has not come to the national level. And then the next question, 5.3, we scored as adequate. Are there in-service training programs providing knowledge and skills related to infant and young child feeding for relevant health and nutrition care providers? And certainly there are many in-service training programs available for working in the field. And of course, 5.4 is inadequate because we don't have responsibility under the code except in the baby-friendly hospital initiative. We scored inadequate in the next three as well. Child health policies do not provide for mothers and babies to stay together when one of them are sick. And in-service training programs are not being provided throughout the country. And infant and young feeding information and skills are not integrated into training programs that focus on especially the code and women's health, etc. So we scored 6 out of 10 here, so that's really impressive. Let's see how we did in the world. You can see here lots of green, lots of blue, and where are we? Wow, we're way up on the yellow here. Who's up here in the green? Turkey, Sri Lanka, Niger, Mozambique, Cuba. They're way at the top. Indicator number 6 is mother support and community outreach, community-based support for the pregnant and breastfeeding mother. And this is asking the question, are there mother support and community outreach systems in place to protect, promote, and support optimal infant and young child feeding? And you can see here, looking at our scoring, that we scored to some degree all the way down. And one of the reasons it's to some degree is because of the WIC program, that women receive access to community-based support systems that are within the governmental policies. So it's not, and that's the issue with this particular criteria. And problem here is 6.4, and we scored 0 on 6.4 because this is asking the question about community-based counseling through mother support groups and support services for the pregnant women, for pregnant and breastfeeding women, that they should be integrated into an overall infant and young child and development policy. And we don't have that. First of all, we don't have a national policy. But when we do put a national policy together, 6.4 is asking us to be sure that we have a national mother support program that's supported and integrated into the national policy. And 6.5, community-based volunteers and health workers are trained in counseling skills for infant and young child feeding. And we have some really fabulous work that's been done here with the Early Head Start program and other programs that are available to folks in the communities around the country, but it's not a requirement, and so we scored. So how are we doing compared to the rest of? You can see there are some green countries here. We are close to the bottom, but we're not in the red. The top scoring countries, once again, Sri Lanka, and here's the Seychelles, the Republic of Korea, Gambia, Cuba, and Cambodia are the green countries for mother support and community outreach. Indicator number 7 is asking the question about information, education, and communication strategies for improving infant and young child feeding. And are these information strategies being implemented? Do not have a national strategy for education that assures that all information and materials are free from commercial interest and potential conflicts of interest. We would have that if we had some compliance with the code. So our answer there is no. 7.2, do national health include individual counseling on infant and young child feeding? Hooray, WIC. This is where we managed to score a solid point. And 7.2b, do national health and nutrition systems include group education and counseling services on infant and young child feeding? Yay, WIC. We scored another point there. But do they include risks, information on the risks of artificial feeding? Usually not. We scored another point for World Breastfeeding Week being for commercial interests. And 7.5, we scored 0 on because we really don't have good materials, including information on the risks of artificial feeding that are in line with the WHO guidelines on the preparation and handling of powdered infant formula. In fact, we have mixed messages when you look at the policies and guidelines on the preparation of powdered infant formula. So we scored 3 on number 7. And where does that put us in the world? You can see by the map, you know where we're going to be. We are going to be in the red, but we're close to the top of the red. So maybe we have hope for moving into the yellow. And once again, you can see that there are a lot of solid 10 countries up at the top of the list. Indicator number 8 is the indicator that addresses infant feeding and HIV. And the question is, are there policies and programs in place to ensure that HIV-positive mothers are supported to carry out the national recommended infant feeding practice? And we scored here on 8.3 about the health workers receiving training on HIV and the risks for various feeding options for infants of HIV-positive mothers. So we do that to some degree, and we do provide HIV testing and counseling, so we got a point there. And 8.8, we do not make special efforts to counter misinformation on HIV for HIV and infant feeding, but we do provide ongoing monitoring to determine the effects of interventions to prevent HIV transmission through breastfeeding and infant feeding practices. So we got a point there. So our total for this was 2.5. When we look at the chart, where will 2.5 put us? You can tell by the map that we are going to be in the red again. And you can see again that there are lots of green countries up at the top. Indicator number 10 is especially disappointing given our experience with hurricanes such as Katrina and Sandy, which preceded our 2016 evaluation. And we've had more national hurricanes, tornadoes, fires since then, and certainly infant and young child feeding during emergencies should be a priority for us in the United States. The question here is, are there appropriate policies and programs in place in order to assure that mothers, infants, and young children will be provided adequate protection and support for appropriate feeding during emergencies? And the question is, do we have a comprehensive policy on infant and young feeding that includes infant feeding in emergencies? Of course, we don't have a comprehensive policy, so it doesn't include infant feeding. Are there people who are tasked with responsibility for national coordination who have been appointed to be responsible for infant and young child feeding in emergencies? And the answer there is no. There were two commissions that were put together after Katrina to look at pediatric and maternal issues, which might include infant and young child feeding. After Katrina, people were appointed to those commissions, but they were not funded and didn't meet. So we don't have a we don't have a preparedness and response plan, and we do not have measures to minimize the risk of artificial feeding, including accepting donations of breast milk substitutes, etc., during emergencies. And probably the most horrifying part about this is that we do have policies on exotic pets during emergencies, but we don't have policies on infants and young child feeding during emergencies. So this is one of our worst scores. We scored 0, 9, which is emergency preparation. So it's not going to surprise you at all to know that we are red. But when you take a look at the redness on the chart here, what you can clearly see is there is a lot of red. There are only 4 countries who scored in the green, and many, many red countries. And we scored in the zeros here, along with many, many other countries scoring in the 0. So this is not just a problem for us. This is really an international problem that we have to do a better job of thinking about infant and young child feeding during emergencies. Indicator number 10 is the mechanisms of monitoring and evaluation systems. In this case, we're looking for systems that would be in place that would routinely collect, analyze, and use data to improve infant and young child feeding practices. And for this indicator, we rely heavily on the CDC. And you can see here that we scored 2, 2, 2, 2, 2, all the way down a perfect 10 on this, thanks to the CDC, who have put monitoring and evaluation components into many, many aspects of data collection in order to have information. We know looking at 10.4, data information related to infant and young child feeding are reported to key decision makers. We know that the CDC representatives and others come to the U.S. Breastfeeding Committee and report on data that are collected. We have our report card that comes out every August, and different reports that come out on the alternate years. So I guess it comes out on even years, and we have different reports that come out on the other year. The CDC has supplements in journals such as Pediatrics that report on monitoring and evaluation. So it's no surprise that we were able to score a perfect 10 on number 10. So where are we? Da, 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 da! all the way up at the top. We made it into the green. Okay. Great job on counting what we're doing. So looking at indicator number 11, questions, the percentage of babies breastfed within an hour of birth. We scored in the blue here, thanks to information from the NPINC. And this is asking the question, timely initiation of breastfeeding within 1 hour of birth. And here we are in the middle of the blues. Question number 12, exclusive breastfeeding for the first 6 months. We scored in the yellow. In asking the question, what percentage of babies 0 to 6 months of age exclusively breastfed in the last 24 hours? Our number was 22.3% in 2016, and we scored in the yellow. And here we are in the bottom third of the yellow. But one thing I want you to notice is that there aren't any greens looking at exclusive breastfeeding for the first 6 months. I think this is really one of the shocking things worldwide is we have this idea that exclusive breastfeeding for the first 6 months is practiced other places in the world, but actually no country is reporting that they are ideally practicing exclusive breastfeeding for the first 6 months. So it's certainly something we all have to work on. Indicator 13, which is looking at the median duration of breastfeeding. Babies are breastfed for a median duration of how many months? Well, we did this in 2016. We had to estimate what our number was. It was certainly under 18 months to have the median duration of breastfeeding. So we didn't actually have a number, but the experts that worked on this felt that certainly our median duration was not over 18 months. So scored in the red. But meanwhile, Ann Dozier is one of the experts in the expert panel, actually did some research on this. So we will now have a definitive number for indicator 13 with the report, which we hope will accept. In this case, we will still score in red because certainly the median is not a lot of red countries. And here we are scoring very close to the bottom in the world in terms of our median duration of breastfeeding. Indicator number 14 is asking what percentage of babies 0 to 12 months are fed with any food or drinks, even breast milk from bottles. Our estimate here was 80%, and it was based on the infant feeding practices studies that had information embedded in it looking at the percentage of babies who were bottle fed, who had been fed from bottles, and 80% puts us in the red category. Where are we here? We're not in the very, very bottom of the red. But again, you'll notice that there is only one green country here, and that's Burkina Faso, that's scored in the green for the bottle feeding indicator. Indicator 15, complementary feeding, the introduction of solid, semi-solid, or soft foods. And here the question really favors us because the key question is asking what percentage of breastfed babies received complementary foods at 6 to 8 months of age. And our estimate is pretty much every baby. Again, thanks to the infant and young child, thanks to the infant feeding practices study. We know that most of the babies in the United States have received solid foods by 8 months. Our problem in the United States is that babies start solid foods too early. But this is not, this is asking a question about preventing stunting and wanting dietary diversity and wanting to be sure that the children are getting a think from food. So the question is really in the other direction. But hooray, we get 10 points on it because are mostly all receiving complementary foods by 8 months. So here we go. Boop, boop, boop. Oh, I went too fast. I was too excited. There we are, right up at the top. The United States and the United Kingdom finally scored up at the top in the green. If the question had been worded a little bit differently, let's say looking at starting solid foods too soon, we would not have scored as well. So the other piece of this that we did in 2017 and we'll be repeating again next year was being challenged, a challenge that was given to us by Dr. Gupta, who's just a fabulous international thinker about how we can implement breastfeeding policies in our own countries and around the world. And he said, you know, the United States is so big, and I can see that you have different breastfeeding rates in different parts of the United States. Wonder how the WBTI would work on a state-by-state basis. And so in 2017, we did all of the states, territories, and the District of Columbia, looking at the individual world breastfeeding trends that we could do on the state basis. So many of the questions would not have a state component to them, and they only have a national component, so we eliminated those. One of the pieces that we did as part of looking at state by state was to put the exclusive breastfeeding rates according to the breastfeeding report, the infant mortality rates, and the maternal mortality rate. So those that are red are scoring in the lowest quartile, the yellows are in the second quartile, and the blue are in the third quartile, and of course the green are in the highest quartile. So we use the same colors as the WBTI to try to look at state by states. And you can see that there are a couple of states that are green all the way across. Rhode Island and Vermont, I think, are green in every sector. Exclusive breastfeeding, infant mortality, and maternal mortality. You can see clearly the issues of exclusive breastfeeding in some states are really reflective of breastfeeding, the breastfeeding coalitions in those states and the work at the Baby Family Hospital Initiative in those states. So this is a really good shorthand for your coalitions. And then if you go to the website, this is the WBTIUSA.org website. You can click on every state and territory and take a look at what the results are for every state. It is interesting that the national weaknesses are generally also the state weaknesses, especially the problem of breastfeeding and infant and young child feeding in emergencies not being reflected in state policies. Again, we found many state policies that were reflective of what to do with exotic pets in case of emergencies. And then that same state would have nothing about what to do with infant and young child feeding and emergencies. So here's just an example. Here is the scoring for Illinois. And you can see the indicators that we looked at were indicator 1, which looks at whether or not there's a state policy. Indicator 4, which is about the maternity leave. Indicator number 9, that looked at protection during emergencies. And indicator number 10, which asked whether or not there were state collections of infant and young child feeding data. You can see Illinois did pretty well here. It's tied for 14th place in the country. I really think that the advantage to looking at state by state, if you are a state coalition, is that this really gives you a blueprint of what you can do on the state level. You can see the pieces that your state already has. You can see where you need to put in the work. And of the states have real opportunities to get onto the emergency preparedness committees and push at that level for infant and feeding policies to be included in the emergency policy. This is something that states take a look at on a regular basis, and they certainly welcome input. Many of them have opportunities for citizens to give input and to relook at emergency preparedness as a sort of annual event. So it's not like you have to wait 10 years to get into it. So please read and comment on the new assessments that we'll be passing out at the USBC meeting and conference in June. And thank you very much for your attention. And if you have any questions, I'm happy to take them.
Thank you, Karen, for that incredibly illuminating presentation. And we can be so focused on domestically how we are doing, and there are so many things that we normalize within the U.S. That it's sobering to see how we compare with other countries, and just this can spur such systems level thinking and thinking about a blueprint for action and how they could combine with the kind of state public health agendas that we have. So absolutely, we have a lot of questions, and one was in the first criteria when we spoke about the national policy versus goals. So we have the Healthy People 2020, or we have, but while you have goals, the difference between that and what does so that doesn't count.
Goals go into monitoring. It's part of monitoring and evaluation. If we wrote a policy that said, we have a policy to reach these goals, and this is the reason that we're doing that, I think that we could sort of scrape in that it's a policy. We do also have the Institute of Medicine, and I know that they've changed their name, but the Institute of Medicine has a statement, for example, but it's not a national policy.
Right.
That's the problem. It really comes under monitoring and evaluation, and looking at our strengths. Our strengths are the U.S. Breastfeeding Committee, the Baby Friendly Hospital Initiative, and the CDC monitoring. Those really are three.
Absolutely. And, the power of data, being able to see that. So because we have so many opportunities for the use of data that we see to do more predictive analytics and to improve the health across the system. So Karen Garcia says, I'm proud to say that I belong to a baby-friendly hospital in Santa Barbara. Congratulations, Karen, and we, it's wonderful to see how, with some of the funding that has gone into the national collaboratives and the baby friendly initiative, how there's definitely been an acceleration in the baby friendly hospital process since from the time when you were first associated with it, right, Karen?
Oh yes, and I think I was at Santa Barbara Cottage Hospital. I was one of the assessors there. It was wonderful. And one of the things I can remember is a mother who came back to be interviewed, and she said, "I love this hospital so much. As soon as I came in today and I smelled the hospital, I remembered how wonderful it was to give birth here."
Wow, that is high praise indeed. Not too many people can feel nostalgic about hospital smells, so that's really a testament to what the support system that the hospital has created to have made. Great. So, and we have a question here which says, has the WBTI or associated organizations created any kind of best practices for implementation or any learning from the countries that are doing well on some of these measures? Is there a plan to be doing that?
There was the reporting that happened in South Africa at the Second World Breastfeeding Summit, and there's a third World Breastfeeding Summit coming up in Brazil in October, I think. And that's an opportunity to for countries to share their best practices. And I was going to say breast practices, but no, best practices, and talk about how they achieve them. But just as a general rule, countries that have a single-payer health system and countries that have a Ministry of Health that is in control of the healthcare system, whereas our Health and Human Services, we have a very diverse healthcare system in the United States. I think those countries have an easier time with some of the implementation steps than we do with our voluntary system.
Absolutely, just not having healthcare for so many. One question is, given that we don't have federal paid leave, like how can you expand a little bit on indicator 14, like some of our breast milk feeding via bottle is hard to capture as a statistic. So when you're looking at that indicator, how is that something that how do you do that?
Sure, and those are two things that go together when babies are separated from their mothers because their mothers are into the formal sector of work. There's no doubt about it that we're going to have a higher percentage of babies who receive bottles. Those two things, I agree with the person who wrote the comment. Those two things absolutely go together.
And Joreen says, big props to WIC for so many of these things, the prenatal care, the others that, that brought up our scores thanks to a program like WIC. However, we get half a point for employee lactation laws because it applies only to wage, the hourly. Why should we get complete points for indicator 2 to 7 A and B when the WIC program only provides services to, its income
exactly
based, and that it doesn't really. So that's why I think the indicator was you got
exactly. So if WIC were expanded, if the WIC education could be expanded, perhaps not so here it is, indicator number 7. I don't know if you can still see my slides, but with indicator number 7, where we're looking at information, education, and support, WIC has such fabulous resources, and some of them, like the WIC website, shared outside of the WIC program, and then we would we could qualify on this if it wasn't just, dedicated to WIC. And one of the things I would like us to think about is education and support. Once these things have been developed for the WIC population, they're so relevant for everybody in the United States. And of course, I'm looking at it selfishly, we get more points. But it really would be wonderful. Thank you, Doreen. You're right.
Yeah. And as someone who has been, has worked in WIC for some years, I know that I was constantly sharing the WIC resources and with my non-WIC friends, because it's like, oh my gosh, if you had any idea of how many great resources are here, but if you're not on WIC, you don't know about it. So really that needs to cross over, because when I had my baby, I was relying on, getting information through my friends and WIC, because my provider did not give me any during my prenatal years in a, hospital in Berkeley, which is supposed to be very progressive and breastfeeding friendly. So.
And I think in the olden days, before the internet, when we thought about sharing resources, we were talking about, actual physical things, printed things that cost money. And of course, we weren't thinking of sharing them outside of the mandated program. But now, the website and web materials are, so fabulous and really so appropriate. So that's something we could maybe think about.
Absolutely. Karen, we have some questions related to the US WBTI group, like how do you collect some of these state level information, like how could people be more involved in this, and definitely when the time to review comes up, USBC will make sure that we disseminate the draft or the link or the report to our network and outside for feedback. But a little bit about your fabulous group that in the US that works on this.
About what? I didn't hear the last word.
The WBTI group in the US that actually kind of, works on getting this data, and how
right.
does...
So the expert panel is actually made up of people. There's a formula for who should be on the expert panel that is set out by the WBTI leadership in India. And so we have to have a doctor, mother-to-mother support people, et cetera. And all of those people have come as they're all serving as representatives at USBC. And then what we did is we met for 5 days, and we worked mostly on the internet, because the rule is that everything has to be available on the internet. So like there could be, something that a state has that they haven't published, although most states have published just about everything. And so after we garnered through 5 days of about 15 hours a day work, garnered all the information and brought it to the USBC meeting. We asked people in the states, we distributed them to the people in the states at the USBC meeting, and asked them to check the references and to be sure that they were, correct. We gave, I think, 3 paper copies to each state coalition, and we did get a significant amount of input from people in the various states, and then the idea is to then make corrections of the drafts and make them available. So the process, the education, the slides of how we orient ourselves, all of that comes from IBFAN Asia.
Wonderful. And for folks, if you are coalition members on this on this call, know that you will get emails. I know Karen was doing a lot of outreach and that through the Coalition Learning Connection, you'll see emails coming out saying, getting in touch with the WBTI expert panel on state. But be sure to do things that, if you haven't read the global strategy report for infant young child feeding, as Karen said, it's so pertinent even today. So be sure to read that. Karen, anything that you can suggest for states as they're thinking about, like this is just such a wonderful way, again, to think about systems level. And how can they use this data with other local data, and how might they also look at sometimes the disparities within, even on some of the scores that we might be doing well at the state level, it's an aggregate score rather than if you kind of splice and dice and see that there still are communities. So suggestions and strategies.
So what we did this year, we jumped off on the international criteria for the WBTI, and we added equity and diversity to our thinking. And so even though there aren't questions about equity in each indicator, the experts looked very carefully at that. And we're going to do the same thing at the state level next year. We're going to really be focusing on equity and gaps in services that are related to that. So that the report that you'll be seeing in June will be different in that case because it will really have this focus on equity.
Wonderful. And as Karen said, that this tool and these state reports and the national report not just gives us a blueprint for action, but also really should spur novel approaches to collaboration. There are just so many places that you look at just how, since the 2016 report, but in the last years of Hurricane Harvey and Maria and, Jose, and the things we hear about just how inadequate it is and how our communities in Puerto Rico came and helped out because sometimes there are no national policies that are put in place. In Alabama, we've heard. In Florida, we've had so many grassroots levels folk that came up and started hotlines and warm lines and support for breastfeeding, for infant feeding moms. So just thinking about them in a preemptive way rather than reactive ways. How can you be forming new collaborations? One question we have, Karen, is that if there are folks wanting to be adopting this, using parts of it, can they reach the expert committee for some guidance and state things? Are you all approachable in terms of helping?
Oh, yes, of course. And the experts worked on certain indicators, although everybody talked about the indicators. We had meetings and people discussed, and we looked at the indicators individually. There were people who worked on each indicator, so they would have the most knowledge about each one, and we can certainly direct you to them. Mm-hmm.
Okay. One question is that with the proposed Healthy People 2030 objectives, being cut down to just one breastfeeding objective on exclusive breastfeeding and a steep reduction from all those different objectives, do you see what then is the role of folks to be using tools like this even more to be tracking, covering? What are your thoughts from your vantage of?
I think it's a travesty. I think it's a travesty that I certainly hope that we'll still numbers that the CDC collects separate from the Healthy People goals, and I certainly hold in my heart the hope that the CDC will continue to collect data so that we'll know where we are. Its best is to is to watch ourselves increase and decrease in minute increments, and that can help us know if we're slipping. So I'm devastated about the Healthy People 2030 goals, and I go to sleep at night hoping that it isn't so.
Yeah, one thing that we do have that, I think should be from our CDC partners is that whether it is on the goal or not is that the monitoring that we are so good at and the data collection is something that is being planned to be continued, whether it shows or not. And I would defer to, some of our team or to CDC, but yes, from the perspective of grassroots advocates and for practitioners, just making sure that if it's, that these data will still be there, hopefully, and we will keep advocating for them, and that is CDC's purpose as well. A question from Jolene Fleming, which says, when will the 2020 evaluation, when will that take place? And you said that you will bring that to the USBC meeting in June, right?
Right. This evaluation will go this June, and the new state evaluations will be the next June.
So
or July or August, whenever it is. Summer of 2020. Yeah.
2020 summer is when the state evaluations will happen, and
yes.
we will be, USBC will definitely be disseminating information about that. Great.
And I certainly hope that in the meanwhile, people will take a look at their own state and let us know if we're missing something already. I mean, we're always taking in information. So if you say, oh, there's something new in our state, let us know about it so that we can put that in the file for next year. And we can actually make corrections online right now if you see mistakes. It's entirely possible to change the numbers.
Wonderful. So the link is in your chat box. It's also on the Power Tools web page. And check out your state report for sure and read the entire report. It's fascinating. It's eye-opening. It gives you ideas. So thank you again so much, Karen, for this.
I had one more thing to say,
please.
And that is that if you look at your state report and you say, oh my gosh, we don't have a state policy, you can just glance through the others and see which state has a policy. And the link will be there to that state's policy so that your coalition group can already have a blueprint to start advocating to your state representatives. Here's what California has done. Here's what New York State has done. Here's a blueprint for infant and young child feeding policies to be included as part of our state. Here's emergency policy that includes infant and young child feeding, which is part of the New York State, for example. So you can look at the state and see what they have. The links are there, so you can hit the link and go right to that state policy.
That's very helpful. That's really helpful. Okay, so again, yes, we folks are wanting to know how will we know when that's happening. Yes, we will send, check out the website now for the report from which has been updated in 2018 too, I see. And then definitely for the upcoming ones, you will get emails through USBC, through other channels as well. So thank you so much, Karen. This was fantastic. And I know that we'll have folks going and listening to the recording again just to see how on each of those indicators, so illuminating to see our scores and then to see that frame of reference.
Thank you so much, Kinkini, for inviting me. And to everybody that's here, please don't be strangers. Thank you. Bye-bye.
Wonderful. Thank you, Karen. And I wanted to invite our fabulous Senior Communications and Program Coordinator, Sarah Walls, to be talking a little bit about USBC updates, very specifically our National Breastfeeding Coalition, the National Breastfeeding Conference and convening. So do you see my screen now?
Yes, I do. Continue.
Okay, wonderful.
Can you go to the next slide, though? Yes, hello, everyone. And Karen, thank you again for such a fabulous presentation. It's so cool to see the data go all the way from the global level to the national level down to the state. It's very cool to see the full scope of the impact of breastfeeding policies. Hello, everyone, and thank you for sticking around for a little bit longer. Actually, yeah, can you go to the next slide? Thank you. It's been really fun to hear about, to remember the process at NBCC 2016, actually, and remember all of the papers being passed out. And to think about that NBCC 2019 is coming up very, very shortly. In fact, in 1 month from today, we will be on our second day of the conference. Please, if you are able and want to join us, we would love to have you. It will be in Bethesda. Our registration deadline is approaching a little soon. It is June 7th, so in about 4 weeks. We hope that if you will connect with us on the event on Facebook to be able to connect with other attendees, find roommates, make plans outside of the conference. We have a lot of information about it on our website, including an updated program schedule, so you can see the types of really incredible and fantastic presentations that are going to be happening at NBCC. It's going to be a really incredible program. And then if your organization or coalition or anything wants to be involved in marketing yourselves at USBC, it's a great way to connect with attendees and connect with breastfeeding advocates from across the country. That deadline is coming up next week, or next Friday on May 24th. So again, feel free to reach out to us with any questions about registration, about marketing, about anything involving the conference. We are happy to help. And we are so excited to see hopefully many of you there in Bethesda in June.
Wonderful. Thank you, Sarah. So much. So yes, we are. It's the countdown, the final mile stretch for those of us, and to the fabulous conference program committee that have been working so hard to put this event together. There is going to be peer sharing and just a wonderful program. So check it out on the website, and we hope to see you there. And I wanted to add also, with just the power of using data and tools like this, we have opportunities, as Karen said, going back to what we can do to improve the landscape of breastfeeding promotion, protection, and support. Here is that for the first time, the dietary guidelines are coming out, which will include guidelines for pregnancy and for infants birth through 2 years. So there are so many opportunities for us to be engaged in the process, to have a say when public comments are being asked for, to work with your state health departments, local health departments, coalition, and other stakeholders and community voices. So stay tuned for many opportunities for collaboration, advocacy, and for program design. And as always, USBC, because of the incredible network of member reps that we have and the gifts that they bring, we do a lot of capacity building. So for state coalitions, national organizations, if you're wanting to work on all of this, know that there is somebody within our network who can help if you need support. So do please complete the evaluation for this session. Give us suggestions for what you might want to see at our next webinars in each of our series, because we do read those evaluations and we bring you topics that are most relevant to you. So on behalf of our team, and a very, very special thanks to Karen. Thanks everybody for being here, and to you for doing the work that you do in the field. So thanks again, and until next time, goodbye.